Good afternoon, everyone. I would like to thank the organizers for giving me this opportunity. I am Curie, a nephrologist from Korea, and have been working in the field of organ donation and transplantation with many communities. Today, I would like to introduce you the Vitallink international activities according to this soda. First, Raphael International. I have established Raphael Clinic and Raphael International in 1997 and 2007 respectively. Raphael Clinic is a free clinic for immigrant workers which has taken care of more than 300,000 patients who came from about 100 different countries. In 2007, we opened Raphael International and started working in Hangul province, which is located outside of Ulaanbaatar, the capital of Mongolia, especially on the prevention and the treatment of chronic non-communicable disease. While we were visiting the Hangul, we were invited to the Mongolian National University of Medical Science and other major public hospitals for lecturing and medical consultations. There, I've met Professor Emeritus Gelangjamjik, who had received the highest respect from the whole Mongolian Medical Society. Professor Emeritus Gelangjamjik asked us to take Mongolian junior medical professors to Korea and educate them, so we started nephrology fellowship program. As the number of visiting professors increased, our friendship between Mongolia and Korea expanded. We opened an annual nephrology conference in Mongolia, which had become the beginning of the Mongolian Society of Nephrology. Meanwhile, we, the Korean Society of Transplantation, has established an NGO Vitallink in 2009 to promote public awareness on disease organ donation, since Korea had very, very low disease organ donation rate. Vitallink has performed various activities, including life-sharing education and events, and one of those activities is medical capacity building in organ donation and transplantation in Asia, because many Asian countries are struggling to establish efficient and ethically acceptable organ transplantation programs. For this purpose, the first Vitallink International Workshop was held in Seoul in 2011, and in 2014, the second Vitallink Workshop was held under the title of How to Reach Self-Sufficiency in Organ Transplantation in Asia. In this workshop, attended by 12 Asian country representatives, was strongly supported by TTS and WHO. Participants selected 6 action targets, and those 6 action targets were national policy, public awareness, networking, professional education, service resources, and transplantation database. Our journey was started from Mongolia, where Raphael International already had many reliable friends through Professor Emeritus Gelangjamjik. We started kidney transplantation workshop at the First Central Hospital and the Mongolian National University of Medical Science in 2013. Professor Jeremy Chapman had attended this workshop at the beginning as an advisor, as you can identify him in this photo. Not only a clinical transplantation seminar, but also a joint LDKT surgery was performed with the fellowship trainees at the First Central Hospital. And we visited MOH to explain the need of DDOT program in Mongolia. In 2015, we could hold a more organized workshop using the basis of nephrology seminar of Raphael International with many medical professionals in nephrology and surgery, and could perform another LDKT joint surgery by introducing laparoscopic donor nephrectomy, and could hold the national conference on DDOT program development with MOH and social leaders, including Buddhist monks, and also opened public discussion on disease organ donation throughout the media, as well as the first Mongolian Donate Life campaign at the Sukhabatar Square, located in the center of the Ulaanbaatar city. The Mongolian Rotarian Club, which is one of the leading opinion groups in Mongolia, has joined to this movement of life sharing in 2017. And the first International Congress of Organ Transplantation was held by the Mongolian Organ Transplantation Association, which was established in 2015 under the leadership of Professor Nyamshu Ren. The Mongolian Transplantation Society expanded and grew every year to start a lecture on organ donation transplantation at Mongolian National University of Medical Science. In 2019, the Disease Organ Donor Identification and Harvest Workshop was held with the RDC-TOT, the regulatory departments of cells, tissue, and organ transplantation. This RDC-TOT is the government agency established by the hard work of Professor Bacholon and his colleagues. The Mongolia Vitallink program produced 69 fellows trained in the field of disease organ donation and transplantation, and hard work of Mongolian friends made it possible to establish a successful DDOT program in Mongolia. We were very much encouraged by the success of Mongolia and started the Myanmar program with Professor Kim Mang-tae and Taji Sue. From the beginning, we contacted MOH and University of Medicine I of Yangon for developing a fellowship program for junior professionals in nephrology and transplantation. When we have finished about 30 fellowship programs in various fields of organ transplantation, we opened a strategy workshop for organ transplantation system building. Participants selected those 5 critical final goals of training in Korea, implementation of clinical transplantation program at the special hospital, building the hospital infrastructure, social support, and global partnership for self-sufficiency. And 4 action plans of legislation, organ procurement organization, education, and hospital infrastructure was selected. Since then, we hosted our annual workshop, which consists of 3 main sections. Those were first, Vitallink workshop for system development, second, clinical conferences, and the third, on-site joint transplantation, which looked much more organized in comparison with our first experience of Mongolia. In 2016, we had those 3 programs that I have just mentioned, of Vitallink and clinical seminars, and 1 joint LDKT surgery. In 2017, we held 1 living-related liver transplantation with another LDKT and started to discuss about establishing a national transplantation laboratory. The next year of 2018, we added an animal surgery workshop, which was the pig-to-pig organ procurement and transplantation of liver and kidney, under the leadership of Professor Tintin Mar and her colleagues. In 2019, an animal skill lab for DDOT was established in UM1, and transplantation database laboratory workshop was provided using the STRAC platform. Meanwhile, more than 40 fellowship programs were provided, and the number of organ transplantation increased continuously. Moreover, in 2019, Professor Tintin Ma and her team accomplished the second DDLT, which has not been performed since the first case of 2004. And the National Transplantation Lab is almost ready. Now, we hope and pray that this current turmoil of COVID-19 and the political situation of Myanmar ends peacefully, so that our friends of Myanmar be back to the hospital safely. In 2018, Professor Harun asked us to visit Dhaka, Bangladesh, and about 300 Bangladesh medical staff in the field of kidney transplantation were actively joined to discuss establishing the DDOT program for Bangladesh. Since Bangladesh already established the LDKT program, Professor Jae-myung Lee could lead a fruitful brain death donor identification management workshop at 4 main hospital ICUs and ERs located in Dhaka in 2019. At the same time, we could introduce our program to the Vietnamese Society of Transplantation via Professor Haiyan at Hanoi. About 60 medical staffs consisted of MOH, WHO, hospital administration departments participated in the facilitation workshop for the dedicated program development. After this workshop, 4 Vietnamese young leaders in transplantation made a site visit trip to Korea. The next year of 2019, we could officially start Vietnam Vitallink seminar on legislation and regulation, hospital infrastructures, organ procurement from deceased donor, and transplantation data management. In Korea, we have continued our annual Vitallink workshop with our Asian partners. In 2016, the KST transformed the KST annual autumn conference into the International Asian Transplantation Week. So from 2016, we could maintain our annual Vitallink seminar during this ATW on different topics such as collaboration and coordination against organ trafficking and education for teenagers and medical students according to the needs of Asian countries. Vitallink actively cooperated not only with ATW but also with AST to establish an efficient and ethical DDOT program in Asia. And Vitallink decided to present the ASD Vitallink Award starting from this cast 2021 to the person who has made significant accomplishment in the field of disease organ procurement and transplantation, because we have seen their determination and hard work against so many obstacles to save lives of patients through organ transplantation. Ending my presentation, I would like to thank Professor Ghazali, Professor Hui, and organizers of CAST 2021, as well as counselors, advisors, and officers of Vitallink, and all the participants to our Vitallink activities for the past 12 years. And I would like to invite you to join the Vitallink International to work together in goodwill until we, all Asian countries, reach self-sufficiency in organ transplantation. Thank you very much for participating.